Hey everybody, Russell Linville here, sports physical therapist, and today I want to talk to you about an exercise program I call the Forearm Big Six. And these exercises are designed to help dynamically support the elbow during athletic movements. What I care about the most is actually protecting the elbow during throwing. And so we know that your inert tissues, your ligaments and joint capsule and stuff like that will help stabilize the elbow during the throwing movement. And we know that the UCL obviously is the primary restraint with throwing, but also the one, because it's the primary restraint, that gets injured the most. So how do we dynamically support this ligament with our muscles? And so a couple muscles, and we'll get into this over the course of the weeks, but Flexor, Carpi, Ulnaris, the muscle helps you kind of flex down and turn in your arm, and then your Flexor, Digitorum, Superficialis. So it's a muscle that helps you flex your digits like this. And those two muscles run down the forearm, and they attach on the footprint here of the medial epicondyle and also cover the UCL. So they help dynamically support this when we lay our arm back to throw. And so if you see my arm gets in this throwing motion, if I squeeze my wrist or wiggle my fingers, you can see how if you follow those muscles down, you can see them dynamically contract. And so what we're trying to do with this program is initiate a foundation of forearm strength. And in later videos, we'll probably talk about grip strength. And so those two things combined is kind of what we do here to make sure that our pitchers and baseball players and throwers' elbows stay healthy from a dynamic standpoint. So again, you have wrist flexion. So basically what you're going to do is allow your wrist to open up, let it roll, the weight roll to your fingertips, curl up, and then flex through at the wrist. Likewise, you'll take a dumbbell, you'll go pronated grip, and you'll go through flexion, extension of the wrist to work on the posterior aspect of your forearm, your extensors. Now take a baseball bat, and you can choke up on this or not. If you're not ready for this, you can use something like a golf club or something of that nature. But baseball bat will work, and you work on pronation and supination. Pronation means turning palm down. Supination means turning palm up. And then finally, you have radial and ulnar deviation. So again, you take a baseball bat, golf club, some sort of object that you have a mechanism to provide a lever with, and you pull thumb side towards your forearm, and then you do pinky side towards your forearm. And those are radial and ulnar deviation. And these exercises will help you generally strengthen the forearm to provide a good base of strength moving forward.